and welcome to our virtual filler event. My name is Emily Burkmann and I'm a certified physician associate and injector here at Koru Medical Spa. Joining me shortly will be Dr. Shellie Norman. She is a doctor of nurse practitioner as well as injector and owner here at Koru. Today we're highlighting a dermal filler product that we've both really grown to love in our practice. It's called RHA, and RHA stands for Resilient Hyaluronic Acid. So the reason we love this is because the filler integrates with the skin beautifully, and it does that because it has a minimal amount of chemical modification. So like other dermal fillers, this filler is made from hyaluronic acid, but it's different because it's made differently. So when the RHA is undergoing the manufacturing process, lower than traditional temperatures are used. And what this means is that the hyaluronic acid in this filler maintains its natural structure, meaning that the product actually mimics your own hyaluronic acid better. So the filler was really designed for dynamic fine lines, meaning the areas of the face that move. And people often come in with concerns about fine lines and wrinkles that move or are caused by movement. And traditionally, this is kind of been a challenge for injectors, because oftentimes when we put filler in areas that are meant to move and should move, we're at a risk of making the area look very firm and stiff and unnatural. But we're super excited because RHA is the first FDA approved dermal filler on the market that is approved for injection of dynamic lines. So what that means for you as our clients is that the filler will move naturally with you as you eat and talk, smile, frown, laugh. It just moves with you and creates a very natural, beautiful result. So soon you'll get to see both Shellie and I inject a couple models. For my model, we are augmenting her lips and her chin, and Shellie will be focusing on the cheeks and the nasolabial folds, which is the line that runs from the nose to the mouth. And we really hope that by watching us inject, you'll see what you can expect during a dermal filler appointment, as well as showcase how beautiful and natural RHA is. And we want to encourage you to stick around until the end, because we'll be announcing some amazing specials, doing an exciting giveaway for one lucky viewer, and we'll also have a live question and answer section with Shellie and I. So save all your questions to the end and let's get to it. Okay, so we're here with our first model, Chriselle, and as you can see, Chriselle is a very young, beautiful patient, doesn't have a lot of fine lines and wrinkles, but what she is looking for is a little bit more volume in her lips. So we already took her before photos. She has topical numbing on her lips right now. We'll let that sit for about 15 more minutes, and then we'll get started. For Chriselle's lips, I'm going to use RHA 2, and I just feel especially for a young patient, like Chriselle, who already has very nice, well-defined, voluminous lips, I feel RHA 2 is very hydrating, and it will give her that nice little plump and natural pucker without overdoing it. So we'll do a little bit of RHA 2 on her lips, and then we'll focus on RHA 3 for just a minimal amount of chin projection, looking to keep the proportions between the lips and the chin very natural and symmetric after the filler's in. Okay, so Chriselle has had her topical numbing cream on now for about 30 minutes, and we've got her all cleaned off, all sanitized, and we are ready to go. Starting off with RHA 2 filler. Again, this is a beautiful filler for the lip area. Just gives a very natural, hydrated look to the lip. Great for people like Chriselle who are younger, already have that nice volume, just want a little bit extra. So we'll go ahead and get started here. And like I said before, I'm going to start by injecting the kind of the medial portion or the center of the lip, just keeping that volume nice and naturally naturally placed, so we have a ton of volume through the middle of our lip, and we want to make sure that that's where we put a majority of our filler, so when we're done, her lips look nice and natural. So on average, we're doing about a half of a syringe to maybe 1 syringe to fill the lips. It's really dependent on the patient, their individual concerns and desires. Some people want a really voluminous lip, and maybe we'll do more like a syringe, and then some people just want that hydrated look. So for those people, we'll maybe stick to like a half syringe, but we definitely customize the treatment to what the patient is desiring. So often I will put a little bit of filler in the vermilion border of the lip on the bottom. That definition is just a very natural, youthful look that a lot of people desire. Okay, so we are back. We finished Chriselle's lip filler and we did a little bit of massaging, went over some pre and post care. So now we have her chin all sanitized and marked, ready for injection. We'll be using RHA 3. So lip and chin filler, they do often go together. And the reason is because if someone has their lips done, especially if they do their lips frequently, maybe once a year, the dimension between their lip here and their chin projection kind of becomes unnatural. The chin tends to be or appear more sunken in, where the lip tissue is more protruding. So for Chriselle, this is her first time doing lip filler, and her proportions are still pretty good. She doesn't need a ton of projection here, but we're going to do just a little bit of RHA 3, assuring that the proportions between her lip and her chin are natural and youthful. As we age, we do lose a little bit of that chin projection, so especially for older patients, building a little bit right through here can be a very youthful look for them. So again, we're using RHA 3, and this is a little bit, more firm filler than the 2. I'm gonna have you turn towards me, head back, and we're just putting little tiny amounts of the filler here. And we'll finish up these last couple injections here, and then we'll get Chriselle all cleaned up and we'll look at her post photos. Okay, so here we have Chriselle's before and after photos. This is her before on this side, after obviously over here. As you can see, we achieved that nice natural volume she was looking for. Her lips appear very hydrated, which is another wonderful benefit of RHA 2. Before her treatment, Chriselle told me that she wanted just a nice natural pucker. So I do think we achieved that with the RHA. We talked about how she does have a little bit of swelling in her lips today from the treatment, and that will go down in the next 24 to 48 hours. So this volume here on the post-treatment photo, that will decrease a little bit, but overall I think we achieved the nice natural look that she was going for. And then on the next comparison here, this is her side profile, so before over here, after over here. As you can see, we gave her just a minimal amount of chin projection with the RHA 3. She didn't need a whole lot of product there, but you can also see her side profile of her lips is beautiful. She's got that nice extra volume while still natural and hydrated. So overall, very awesome treatment for Chriselle. She's very satisfied with her results, and I hope this gave you a little better idea of how we can use both RHA 3 and RHA 2 to augment the lips and the chin.
Hi, it's Dr. Shellie here at Koru Medical Spa, and I am here with my lovely model Emma, who's also my daughter, by the way, visiting from New Zealand, so I'm going to be really transparent with you. And Emma has always felt that she has a little flatness around the cheek area, so she would love to have a little more contour in the cheeks. So we're going to be adding some cheeks to her. We're going to be using RHA 4. As you can see, she's absolutely gorgeous. but she just wants to enhance her gorgeous looks, okay? She wants a little more volume here in the cheek area, which after we put volume here, it's going to help her under eye circles, and it's also going to be helping these nasolabial folds. So I like to start with the cheeks, and then we go back and we refine nasolabial folds and under eyes if needed. Okay, so this is a little lidocaine with bicarb. We always make sure that the guest does not have an allergy to any lidocaine or bicarb. So do you have an allergy to lidocaine or bicarb? Okay, so all we're going to do is inject a little bit in right where I'm going to be making what I call a pilot hole. So first, to give her a little projection and lift from here, we're just going to inject down on close to the bone. Okay. Pulling back to make sure we're not in a vessel. Okay, Emma, now we're going to use a cannula, okay? It looks scary, but a lot of people, I find, really tolerate the cannula really well. We go in with a little pilot hole, okay, and then I'm going to place this cannula. I can put it at different depths of your skin. It's blunt edged, and which makes it a little safer because we can't cannulate or go into a vessel, okay, one of your arterial vessels, which can be a problem. It's always a risk with filler, no matter what brand of filler. That is always a risk. So that was something you signed on your consent, is acknowledging that risk, okay? Okay, so first I'm going to make a pilot hole. Yeah, so Emma has kind of a round face anyway, and just projecting out that chin is going to make her, right here, the contour of her submental area look thinner, just by giving her a little chin. Also give her that triangular beauty look. Okay, Emma, so. Thank you for joining us. We hope you enjoyed watching our lovely models receive their treatments. As you could see, these RHA filler injections were minimally painful, and they truly did result in a beautiful, natural look. They could move their face, they could smile, and they had very natural facial rejuvenation after the injections. Our goal here at Koru Medical Spa is to make you look beautiful and refreshed while enhancing your own individual beauty, but not changing who you are. All right, stay tuned a little longer because we're going to be moving into our live question and answer time with myself and Emily, our PA. But before we do that, it's finally time to announce our RHA special, which we're going to have available exclusively here at Koru Medical Spa for the next 4 days only. So if you book your RHA filler appointment before the end of the day on Monday, September 19th, you're going to receive 30% off your entire treatment. That's right, you heard me, 30% off. And that's a treatment that's going to be recommended by your injector to enhance your natural looks and to give you the results that you desire. In addition to this special, which is available to everyone who's watching this virtual event, we're going to be giving away at the end of this event tonight, for those that attend, one very lucky guest is going to receive not one, but 2 free RHA filler syringes, which ends up being a $1,700 value. That's right, you heard me, $1,700 value. 2 free RHA filler syringes. So without further ado, let's move into that live question and answer time. And remember, at the end of this event, we're going to be doing our giveaway.
Hello, everyone.
Hi, thank you for joining us. How exciting.
Yeah, welcome to our live question and answer time. We've already had a lot of questions rolling in, so we'll just kind of start at the bottom here. Our first question was, how does the pricing compare to Botox? So,
well, actually, they're two different things. So we have Botox, which is a neurotoxin wrinkle relaxer. And it works differently. And we often use both fillers and Botox together to give you that perfect result that you're looking for.
Yeah, and they last a little bit different too. So Botox you do a little bit more frequently. We're usually seeing people on average about every 3 months for that, whereas fillers last a little bit longer, and we'll get into that shortly. There's lots of questions about that. So
I hope we answered your question on that.
Yeah. Okay, what can I do before my appointment to prevent bruising and swelling? Really good question. We get this a lot in the clinic. The first thing I tell people is try to avoid alcohol, aspirin, Aleve, ibuprofen a couple days beforehand, even if you can. And I really like when people take arnica before they come in.
It does help.
Yeah,
it does help.
Oral arnica, topical arnica. We apply that after the treatment as well, but that can be really helpful.
And even some supplements can cause more bruising.
Yeah, that's true.
Yeah, so like fish oils, maybe just stopping it a few days before would help.
Yeah, won't hurt. That's for sure. Okay. This person says, I have other fillers that are wearing off. Can I get RHA? Does it hurt to combine filler? What do you think?
No, actually, I probably have quite a few different ones. And I've done really well with each one. So no, you're going to be fine to do RHA fillers.
Yeah, very common to combine different types of filler. So no problem with that. Does filler last longer if I combine with Botox? We were talking about this beforehand. We don't think so. We feel that Botox and filler complement each other very well.
Yeah.
But getting Botox before or after your filler treatment probably won't affect how long it lasts. So, how long does filler last? How long does this filler last?
Yeah, we're talking today about RHA, and RHA is been approved for up to 15 months. So that's a long time.
That's pretty good.
Yeah.
It's pretty good. That means you're coming in once a year or less than that. So yeah. Okay. How far in advance from a big event do I need to get my filler done? I'm so happy somebody asked this.
I am really happy too.
This is like something that we struggle with. So we prefer like a month, honestly. If you can make it a month, that would be wonderful.
Yes.
We'll talk probably eventually about side effects and things like that. But one of the biggest things is swelling and bruising. And we don't want you bruised for your big event. We don't want you swollen for your big event. Please don't come in the week before your wedding and ask us to do filler on you.
Yeah, and we've had that.
We've had that,
So,
yeah. So technically a couple weeks, but honestly, just make it a month and then we won't have to be concerned at all. So.
Yeah. Plus, I just love how filler looks after a month. Sometimes I can get it done and I think it maybe looks a little sharp, maybe my cheeks look a little sharp, but you just have to give it some time and it really smooths out, it settles in, starts moving with you. It actually, even your skin starts looking better because that hyaluronic acid is working in there. I mean, I love the effects of filler after about a month. So if you have a big event, because the holidays are coming, everyone, please start calling and making your appointments now.
Yeah, I agree. Filler looks wonderful at a month. Okay, I've had this question before too. Do I need to worry about being a side sleeper? Will I mess up my filler if I have my cheeks done? No.
No.
It's ideal to lay on your back.
Yes.
It's ideal, but I can't do that. And I know a lot of people can't. So no, you won't mess up your cheek filler. If you can sleep on your back, you should be doing that anyway.
Yeah. We really recommend that,
Yeah.
for beauty purposes, that we're sleeping on our back.
Yeah. But you will not mess it up. Okay, this one says, how long does this lip filler last? Shellie kind of mentioned earlier, but these are, all the RHA fillers are FDA approved for up to 15 months.
Yes.
So,
however,
yes,
I'm going to say, however, everybody's very different. We all metabolize differently. And so you can't necessarily, we can't promise you that it's going to last for 15 months.
Yes.
What I do know about filler, though, is once you've had filler, it never quite goes down to pre-filler size. And so you're going to get more longevity, I believe. This is just from my experience. Whether I've read it in the literature, I'm not sure about that. But the more you've had filler, the longer it seems less. And what I think, and tell me if you agree with me, but people who get to correction and then they come in and they maybe do a syringe or a couple syringes, they tend to do better overall in the long run.
Absolutely.
Yeah.
Yep.
Than somebody who lets everything just go for a couple years and then comes back.
Yep. It's much easier, and there's better outcomes when people maintain their filler that way, I think. Yeah. Okay. Can you treat the entire face, under the eyes, cheeks, and mouth area?
Well, RHA has a filler for each of those areas. Mm-hmm. So we're going to choose which filler is appropriate for your desired results. So that's why you need to schedule a consultation rather than just coming in to get filler. We need to sit down with you, take a look, and see where maybe there's a deficit or where we might improve on some areas. And then from there, just like a doctor writes a prescription for medication, we're going to write a prescription for your filler. And there's each filler that RHA has is for a different area. Yes. So RHA4 we use in the cheeks quite often, and it's good for giving that projection. That's another place for giving the projection on the chin. Mm-hmm. RHA3 is wonderful if you have deep nasolabial folds. Mm-hmm. RHA2 is great for lips if you just want that hydration look on lips. So depending on what your need is, we're going to prescribe you a filler to take care of that.
Yes, filler is very individualized, so you'll get an individualized treatment plan. Okay, let's see. Someone loves that you're using your daughter as a model. Oh, she's so pretty.
My daughter loved that she was being used as a model.
She was great. Okay, so we talked about the chin and the lower jaw area. This person says, the lower jaw around the mouth is what is falling most on my face at age 61. Will this product work for women my age?
Oh, yes. My goodness. Yeah. Yes. Yeah. It's, sometimes I'm just blown away by how beautiful people look after just a little bit of refinement. Yeah. With filler. It's not, you don't have to distort how you look. No. I mean, have you found that?
Yeah, absolutely. And that's kind of that's kind of what we do here. We love natural results. We love enhancing what you already have and not changing who you are. And we've treated people of all ages, young, older. I mean, yeah. So 61, absolutely. You are not too old to have this filler. We would love to treat you. Okay. Let's see here. I think that
somebody's asking how RHA is different. Yeah. One thing we can say is RHA was FDA approved for dynamic wrinkles, which that is different than other fillers. So dynamic means wrinkles that you get when you're moving. I think others might have been approved for static. I'm not sure about that.
Yeah, I believe as of right now, RHA is the only filler on the market that's approved, FDA approved, for dynamic lines, like she said. So, and that's a lot of times people come in and they're concerned about dynamic lines, right? Lines around the mouth. I can't tell you how many times I give someone a mirror and they're like, oh, it's right here. It's this. It's around my mouth. So those are dynamic lines. And that is one thing that separates this filler from others as of right now. So.
And they just came out with a new one. Redensity. Yeah. So we're real excited. We haven't been able to play with it, I guess we might say, in our field yet, but it's going to be a game changer for these perioral lines that were just, woman after woman comes in really distressed over those. So we're super excited about that new filler.
Yeah, super excited. This person, true believer with arnica and the tablets. Yes, arnica gel, oral arnica, absolutely can really help with that bruising. So let's see. Would I need to come in for a touch-up, like for Botox? For a touch-up, I think we kind of touched on that. Filler's best when you do maintain it. So it's not like Botox necessarily where you would come in every 3 months. But I think once you get to the point where you're truly happy with your filler, like Shellie said, it's better to come in and do smaller amounts at a time rather than wait like a year and a half, have all of the filler, you know, be not fully gone, but mostly gone, and then try to start over at square one. Yeah. So it's not necessarily, there isn't a one size fits all. You don't come in at 6 months and then 8 or whatever, but it's better when you do maintain it to some degree.
Yeah, it's different than our neurotoxins where you do start seeing them wear off at 3 and 4 months.
Right. Yep. Yeah. Usually lasts 15 months. Yes, we talked about that. How does RHA differ in comparison to Sculptra?
Totally different.
Different. Yeah, they're very different. You can talk about Sculptra.
Yeah, so Sculptra is like what suture material is made of in a liquid form, and we put it in there to volumize. It actually improves skin tone also, and it when we put it in, it actually goes down because it's mostly water that you're seeing that improvement. Mm-hmm. And then over time, it stimulates the elastin and collagen production, whereas filler is actually giving that volume right away.
Right.
So in Sculptra, you're going to be waiting a couple months to start seeing the changes for that.
Yep. And filler, the results are, a lot of people say the results are immediate. We feel filler looks the best at a month, but yes, you do see that volume right away.
Yeah, a lot of people have fun looking in the mirror right after. Mm-hmm. We have fun looking at it when we see people. It's super fun to take a before and a right after picture.
Yep. If I'm having Mohs surgery on my neck, how long do you have to wait after surgery to have the filler? Well, I mean, if they're having surgery on their neck and we're going to treat their cheeks or something, that there's really not much of a whenever you're up for it, I guess. I mean, you just had surgery, so
the really I found in reading the literature about RHA is they didn't have a lot of delayed onset problems with this filler.
Right.
So sometimes I'm a little concerned about that, but from what I was reading with RHA, they didn't seem to have delayed nodules or problems. So I would always, a rule of thumb, we always kind of say 2 weeks just to be safe, but I think you'll be okay.
Yeah. Let's see.
Book a consultation.
Oh, there we go. If I book a consultation, can I get filler done the same day? I think it's individualized.
Yeah, I agree with you on that.
It's individualized.
Yeah, we often can. We often can. We often can. Sometimes what we find is we will have a consultation with somebody, really tell them what it's going to be about, and then they just want to give it some time before. So that, so if we're going to book your consultation at the same time as your filler, we're going to be booking out probably an hour and a half.
Yeah.
So
the consult is really not. I mean, like she said, often we do. And we can do filler right after we consult, but we want to know about your life. We want to know, did you just drink 4 glasses of wine last night? Do you care about bruising? What do you have going on next week? So it's individualized.
Yeah.
Let's see. If I only want a half syringe, will we be able to bank or save the rest for later use, or can we purchase a half syringe?
You know, a syringe is only 1/5 of a teaspoon.
Yeah.
So we pretty much can find a place to put the other half of the syringe. Maybe you don't want it all in your lips, but we usually can find another area to do the rest of the syringe.
Yeah, I think there's a misconception out there that a syringe of filler is a lot. I get that from time to time. People think, oh, a whole syringe, but it truly is, although it can give amazing, incredible improvements, it's a pretty small amount of product. So I agree. We can always find somewhere to put it.
Yeah.
Okay. Let's see. Is there downtime? That's a good question. There's a little bit of downtime, just as far as you assume that you're going to be swollen, and bruising is so variable. Some people don't even look like you touched them as far as bruising, and some people bruise a lot. So, I mean, kind of 2 weeks. We always say 2 weeks for everything, but there's a little bit of downtime. Don't plan anything important that following week or so.
Yeah, you don't want to come in, get your lips done, and probably go out that night. Maybe, but maybe.
You gotta get a concealer. I don't know. Okay. You guys have really good questions. Actually, that's getting towards the end here. Just want to make sure we didn't miss anything important. For wrinkles at the eye corners, should I use Botox or RHA? Typically, for crow's feet is another term people will use. We're doing neurotoxin, Botox, there's other types. But it would depend. I mean, if you had a ton of volume loss around your eyes, sometimes we do filler there. So
I'm really excited about the Redensity.
Yeah.
I think for the kind of the fanning wrinkles that some people have on the side, I think Redensity is going to be a game changer.
Yeah,
for that.
Definitely.
Yeah.
More to come on Redensity. We're pretty excited to start using that. So, okay. Well, I think that's kind of wrapping up our questions here. Just a reminder of the amazing special that we already announced, 30% off of your RHA filler treatment. And that will be as recommended by Shellie or I. So we really like to customize your treatment plan. So that is for everybody that attended the event, right?
Yes.
Everyone that's attending tonight.
And of course, you have to call us and
or
text, which is really great. You can text us at 808-339-3595.
Yep. So, and that's by Monday, September 19th. So this isn't lasting like all week or anything. It's just until the end of the day on Monday, the 19th, which is this coming Monday. So, and one lucky attendee will soon be drawn to receive 2 free RHA filler syringes. So the winner of that giveaway will be notified via text or email, and that will likely happen tomorrow. I think we decided, right? Tomorrow.
Yes.
So, So we're so happy.
So watch for that video.
Yes. Check your email tomorrow.
Yes.
Tomorrow's Friday. Most people are still checking their emails on Friday. So. All right. Well, we're so happy that you joined us.
Yeah, that was a lot of fun.
Yeah, I'm sure there's more questions, but we can answer any other questions you have when you come see us for a consult. So we look forward to seeing you soon.
Yeah, that's going to be fun. Thank you, everyone.
Have a good night.
Bye.